Hi, everybody. Thanks so much for listening and joining. Today, something I just want to discuss briefly is our Dyad approach to patient care that we have at our office at Clearfork Pediatric Dentistry. And what I mean by Dyad approach to care is that that the health of my patient exists in this broader context, and that includes the relationship that my patient has with their parent, their primary caregiver, often their mother, father, or the person who's with them most often. So we understand that when we see our patients, especially if we're meeting them for the first time, and especially if they're being referred to us from another office, and this patient we know is going to have treatment needs, we know that we're meeting this person and this family for the first time, and that we're about to recommend a lot of treatment. And that potentially can be scary on a number of levels. You know, it can be invasive. We might be recommending some kind of sedation. We're going to recommend different kinds of treatments, and we know that it is often something that is expensive for families, and that's stressful. In order to best treat our patients, we believe that any treatment considerations will have the best outcome if there's a discussion with the family regarding the different options. So that's a two-way conversation that we have. You know, I will make my recommendations based on my training, my expertise, what I believe will have the best outcome. And then it's kind of up for discussion and what the family thinks will be best, because they're the sounding board. They're the one that knows their child best in kind of the broader context. You know, sometimes that means that what I recommend and doesn't feel right to the family, and it doesn't mean that we drastically change what we're offering. There's only, you know, so much I'm going to recommend and do based on certain parameters, what I think is safe and what I think will work. But there can almost always be some kind of give and take in terms of what's different treatments available, what different sedation options are available, and just make sure that the family feels comfortable with treatment as well, because it's a big deal to make a decision for your child and to trust us to take care of these children. And it's something that we take very seriously, and we're honored by it. So in any event, I hope that was helpful, and thanks again for tuning in.